here in Richmond, where Dr. AVULA says that the case rate per 100,000 in the city has been increasing over the last 35 days or so, and they're seeing an increase in the number of outbreaks. And he's saying that families are going to have to reconsider how they get together and offer up sort of a phased approach to making it safer. As Thanksgiving and the December holidays approach, Richmond Health Director Dr. Danny AVULA says people will need to make a choice.
This is a risk-benefit calculation
On whether to have a large traditional family get-together.
If you've got older members of your family with underlying conditions, then they are going to want to think twice.
AVULA says the safest option is none at all, and to keep it within your quarantine circle. But if you are planning one, he recommends several precautions. Beforehand, get tested for the virus and go on a lockdown for a week or two.
Because going into that, you want to minimize the risk that you have inadvertently caught COVID and are potentially spreading it.
And for out-of-town visitors, AVULA says different households should not stay under the same roof.
When somebody has COVID, it's about a 10% infectivity risk for other members of that household.
And when the get-together actually happens, AVULA says as much as possible, keep activities outside, wear a mask, and maintain social distance.
We know that COVID is a function of time spent together and distance from each other. And the closer you are, the longer period of time, the higher your risk is.
And afterwards, another 14-day lockdown before returning to work or school. AVULA says he knows these steps sound draconian, but adds the era of COVID is such a different pace than we've ever had to operate under.
These are the types of adjustments we want to think about making, particularly as here in Richmond and everywhere around the country is experiencing higher and higher rates of COVID.
And AVULA says the other important thing that people need to realize is the wide variety of symptoms that COVID-19 can present as, and to not discount if you have something like a scratchy throat, to chalk it up to allergies only to find out 2 days later that it's gotten worse and you do in fact have COVID-19. So he's saying if you have any sort of symptoms, be conservative, avoid social gatherings, and get tested.